And now it's Boomer Life. Lifestyle ideas designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life with Sterling Fox.
Well, good morning, and welcome to Boomer Life here on AM 650. A real pleasure to introduce our guests from the Integrative Naturopathic Medical Center in Vancouver. Back with us in studio is Dr. Larry Chan, joined for the first time, and it's about time, by Dr. Eric Posen. Gentlemen, welcome. It's good to see you both.
Good morning. Thank you.
Dr. Eric Posen, a long overdue visit from you, sir. You are, along with Dr. Larry Chan, and who's the third member of this trio?
Dr. Hal Brown.
The three of you are the co-founders of the Integrative Naturopathic Medical Center. Take us back to the early days and the formative years. Tell us the story, Eric.
Oh, my God, it's a long time ago. I think it's over 36 years ago. And it started when Vancouver was radically different. As a matter of fact, I was a chiropractor at the time. Larry was still in school. Hal was a chiropractor. And you could probably count on one hand the number of people doing the kind of medicine that we're doing today.
Right. Now, back in those days, that was a radical alternative medicine, wasn't it?
It was beyond even alternative. It was out there, woo-woo, any number of names that were categorically pejorative against it, you were an outlier.
Right.
That's really what it was.
And what kind of medicine was it in those? I don't imagine it's terribly different nowadays, but what was it that was so radical and weird?
It was just not using drugs.
Aha.
It was using natural means to help heal the body. And as a chiropractor in 1978, it was pretty limited as well. As a matter of fact, the Act in British Columbia was so narrow that if you came in to see me with a wrist problem, I couldn't touch your wrist. I could only work on your spine.
Interesting.
And so, thankfully, it's blossomed and grown from there. But at that time, we were all growing. New things were coming. New information was coming. And everyone ran up to the limit of how their own therapies worked at any one time.
Okay.
So you needed to find something different.
Right.
And so we got involved with different studies and new things. And I realized I wanted to not be alone anymore. Certainly not personally, but professionally.
Okay.
And so I took a holiday and I asked Larry to come and be a locum for me. And after I returned, I thought it was such a great idea and I really liked him so much. And my other partner, Hal Brown, who was in Victoria, was also someone who I'd worked with a year or so before. And I said, let's all get together and see if we can create something new and different in Vancouver that doesn't exist previously. And that's how we came together. We had a different name at the time, but certainly under our own names. And we were working as chiropractors.
Okay.
That worked really well.
So was the business established first in those days? And you were the replacement, the locum that filled in for Eric while he was taking a break. And then you were approached, and it sounded like an okay idea. But was the business a chiropractic enterprise in those early days exclusively, Larry?
Initially, we were just chiropractors, but we did basically a holistic kind of chiropractic medicine at that time.
Okay.
Well. And then when we got together, we formed a name called Intergrative Healing Arts at that time.
Right.
And we incorporated nutrition with our medicine as well. And eventually we added other components as we developed more skills, professional skills, such as acupuncture we put in there, Chinese medicine, and naturopathic medicine as we grew as well. So
I see. So you now talk about your accreditations, Eric, because you've already described yourself as a chiropractor,
right.
But you haven't exactly been resting on your laurels since you finished your chiropractic training. What else have you accumulated over the years?
So I stopped being a chiropractor in about 1985. When I became a naturopathic physician in British Columbia. So I had to go back to school for that. Did
you have to leave British Columbia in order to become a naturopathic physician? You don't nowadays, but back in the 80s, did you have to go somewhere else?
No, there was one school in Canada at the time, in Ontario.
Okay.
At that time it was called the Ontario College of Naturopathic Medicine.
Okay.
Now the Canadian College of Naturopathic Medicine. And they thankfully had a program for people who already had diagnostic healthcare degrees, such as dentists, medical doctors, and chiropractors.
Oh, I see.
And so as this postgraduate program developed, that went on for a 4-year period of time, and thankfully we didn't have to leave. They brought the program to us. And I'm very grateful for that. But over that period of time, through the stresses and strains of going to school as well as keeping a full-time practice going, we finally emerged from that and had our naturopathic degrees.
So are all three of you, Dr. Larry and Dr. Brown, are you all three naturopathic physicians as well as being chiropractors?
And we also studied Chinese medicine, so we also registered acupuncture.
I was just going to say, and there's acupuncture accreditation in there as well, isn't there?
Right, so those are some of the accreditations, and then we've all done things ancillary to that. For instance, osteopathic cranial manipulation has been something I've been interested in for years, and I certified to teach in that.
Can you tell us what osteopathic cranial manipulation is?
That's true. That's one of those things you just sort of drop on the crowd and
Well,
walk away, isn't it?
It landed like a bowling ball in my lap, but I'm curious, Eric. I really am.
Osteopathy is a whole other health discipline that developed at the same time as chiropractic did in the late 19th century.
Okay.
And in the early part of the 20th century, a osteopath in particular was very involved with the idea that if there are joints in the skull, there are these sutures, they must actually move. And so he took that idea and sort of ran with it for a period of time. It actually now has probably about 100 years of clinical experience behind it. It's not quite the same thing that he thought it was in the beginning, but it works very clearly with the fascia in the body, the connective tissue of the body.
Okay.
Which is something which naturopathic medicine works with on a daily basis. Mm-hmm. And it works at it from a mechanical perspective, using the bones of the skull and different parts of the body as levers to get at the entire connective tissue of the body. So what does that mean? Well, say you strain your foot when you're out running.
Mm-hmm.
That makes you hobble for a period of time because it hurts.
Yes.
You put your weight on the other leg. Then next thing you know, it starts to hurt in your lower back, and then you twist your upper body, and then you twist your neck, and then you got a twitch in your left eye, all because of this strained ankle on your left side. So where does that come from? Well, it comes from the nervous system adapting. It comes from the connective tissue adapting. And so it uses a series of fulcra in the body to try to reestablish the normal balance before you got and injured your ankle. So it's a very subtle system. It's not like a chiropractic style manipulation, and it works a lot with the head. And I've always been interested in the head.
Okay.
The head, the brain, and everything that goes on in between. And so it was my first way of physically getting at how the brain can be manipulated in terms of function and ease, just by working with the actual structure of the bones.
Interesting stuff. Fascinating. So back to those formative years. You and the three of you are now accumulating accreditations and expanding your areas, your skill sets, mm-hmm. and your areas of expertise. But eventually, the business begins to expand as well, right. And suddenly it becomes quite obvious that you're going to need some assistance, but not just administrative assistance. You're going to need technically skilled assistance to provide additional services. How far into the plan with the three of you, Dr. Eric, did the expansion begin?
It was probably a case of, oh my God, now we need someone.
Right.
As you just say, like months after the real need arose. So we were very lucky in that we had a period of time where we were working and we could turn to the people we've actually treated when they were young and had now developed and moved to a point where they were now doctors themselves.
And he's referring specifically to Dr. Katie Leah, who has been a guest on this program from the Integrative Naturopathic Medical Center, and she's told the other side of that story, right. Eric, and it's a great story. She was a patient. Exactly. As a little girl, she and her family, and you treated her family, and eventually she became a medical colleague.
So all of a sudden we had a pool. I'd created a pool from which we could draw associates and mm-hmm. their strength and their new knowledge to help us out. We also developed diagnostic techniques that required people to help us in evaluating patients when they first came in.
Right.
So we created a whole series of, or rather we trained people to work in those diagnostic techniques. There's one particular system we use that uses acupuncture systems as an evaluation. And so that took a lot of time. We also brought people in who do acupuncture, chiropractic. Who else do we have there?
Dietitians.
Oh, sorry, there's so many people there now.
Right.
All over a period of time, because you just can't do it all by yourself.
Right, but it's been an exponential growth. I mean, it's you've nurtured the business and grown it in a sort of organic way.
And the word integrative then came about, and nowadays you see integrative everywhere.
That's right.
But we started as one of the few in Canada that had the label integrative healing arts, because we looked at the body from a holistic integrative standpoint. And for example, Mrs. Jones comes to the office. As chiropractors, you see Mrs. Jones come in, she'll say, I've got terrible digestive problems. I got really sore joints everywhere. As a chiropractor, what do you do for that? You can adjust the joints, fix the spine, but then there's a nutritional component.
Absolutely.
So how do we address that issue? And there's inflammation in the wrists. So how do we just address that issue? So we have to bring all these other tools, whether it's diet analysis, detoxification, strengthening the organ systems to make her fatigue go away. All those factors are there, and that's why we became integrative, because you need to draw upon all those elements to make the person better.
Right. So, Eric, how would you describe, now that the business has grown to the point where it's big enough for a name change, and you went from Integrative Healing Arts to the current Integrative Naturopathic Medical Center? This is all quite recent. So how would you describe to one of our BoomerLife listeners right now what Integrative Naturopathic Medical Center does? If I'm ailing in some way or another, how can you at Integrative help me?
That's a great question. And the reason it's a great question is the starting point is usually for most people pain.
Okay.
Something doesn't feel right. I have a headache, my stomach hurts, or I can't sleep at night, which is a form of pain.
Oh, absolutely. Sleep deprivation is no fun.
Exactly. So people come in with a concern. Maybe about 5% of people do walk in the door and say, I have absolutely no concern. I just want to know how I'm doing.
Okay.
But most people do come in with a concern.
Sure.
And so we use that as our starting point. We use it as a place, first of all, to confirm some kind of diagnosis. Like, what is it that seems to be off?
What's bugging you?
What's bugging you? Is it here? Is it there?
Right.
We use standard medical tests, lab tests. We get access. Thankfully, the most of the medical doctors in the Lower Mainland are very cooperative with the model of medicine that we have. And so when we request records of recent tests that patients have had, they've been very forthcoming with that stuff. So we don't have to duplicate services that way and cost more money, have people pay more funds outlay. Then we do diagnosis of a different level as well, because can I make a bigger statement here about how we become ill?
Yeah.
Is that whenever something happens that produces pain, pain is a cardinal sign of inflammation. And we've all heard that word.
Absolutely.
And we all know what it feels like. Inflammation hurts. It also is red. It limits your movement. Things don't work right. But most people don't know that inflammation is what our bodies do on their own to try to remove some kind of stress. It could be a mechanical stress, like you're dropping a rock on your foot, or it could be you being up all night because your boss is on your case about something. So whenever inflammation arises, it produces symptoms. Well, that's uncomfortable. But if you go to your general practitioner or the hospital and say, I got this tightness in my chest, and I have a hard time breathing, they're going to run a whole series of tests for your respiratory and your cardiac function.
Yeah, it's they would tweak on the heart thing.
Exactly.
Tightness in my chest. Chest pains. And
Rightly.
You know what they're going to do.
Rightly.
Right.
But you've been in emergency now for 12 hours, and they say, we can't find a thing.
Right.
It's anxiety.
Go home.
Go home.
Right.
Take an Ativan. So you got these little pills, but you still got this tightness in your chest. You can't breathe. You're having a panic attack. What am I going to do? So when someone comes to see us with that kind of problem, we have to find another way of trying to evaluate what's going on. So we make another jump. Our entire body is made up of something called connective tissue.
Okay.
you've seen it. You cut a chicken breast, it's the clear fascia you pull off of it.
Mm-hmm.
But at its most discrete level, it's the walls between cells. It's your blood. That's the battleground where inflammation occurs. Now, we also have something that vitalizes the connective tissue. And I'm going to make another jump here in paradigm.
Okay.
It's the acupuncture system.
Oh.
Without that, you're a piece of meat in, can I use trade names here?
Sure.
Safeway.
Okay.
You're just a piece of meat in a store. It's your life force. It's the life force that animates you. And so if inflammation shows up in the physical body and the connective tissue, it's also going to affect the acupuncture channels. So at Integrative Center for, sorry, I keep changing the name on us, at the Integrative Naturopathic Medical Center, we've developed systems to evaluate those acupuncture systems as well.
Right.
Because the thing that's going to cause you pain in your chest and that anxiety is not going to show up on standard tests for organ function.
They took 12 hours and couldn't find anything in the hospital.
Exactly. But within probably about 20 minutes, it's going to show up on acupuncture channel testing.
Interesting. So, Larry, this is the big picture that you were talking about earlier, the holistic approach. There's more to it than whatever your symptoms are. They represent a problem, and they may hurt, but there's more to it than probably what you think there is.
Absolutely, Stu. Obviously, Sterling. Basically, the whole idea is if you have a symptom or complex that patient's presenting, but there's no diagnosis given from standard medical diagnosis, it doesn't mean it doesn't exist. It's hidden somewhere in different layers in the body. And it's up to us with different diagnostic eyes to see what that is.
Mm-hmm.
And that's the basis of prevention in our medicine, because if you can catch things early, you can read the signs, you can do something about it.
All right,
with our many tools.
We need to take a quick break here. Great opening segment and a good explanation of what one can expect, the multiplicity of services available at Integrative Naturopathic Medical Center. Our guests are Dr. Larry Chan and Dr. Eric Posen. You're listening to Boomer Life here on AM 650. Lots more straight ahead. Stay with us.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on AM 650.